Hi, everyone. My name is Adrienne Romney, and today I'm going to be presenting about my summer internship. This summer, I was a health consulting intern with Mercer in their health and benefits program. So a little bit about me. Again, my name is Adrienne Romney. I'm a senior majoring in public health, and I'm also minoring in healthcare leadership. This summer, I interned at Mercer with our health and benefits team. My role is a health consulting intern. And fun fact, I actually found out about Mercer's internship program at the BYU Healthcare Leadership Career Fair. So it was really fun to utilize the resources that my minor had, and I was able to find my internship that way. Some of the learning objectives for my internship that I created at the beginning of this semester, the beginning of this class, I wanted to talk about, and there's four of them, four specific ones that I wanted to focus on. The first one is that I wanted to complete 3 stretch assignments that focused on using advanced Excel functions. This is something that I was really wanting to work on coming into my internship, and also why I specifically chose this internship, because I wanted to develop some more hard skills, specifically in Excel. I wanted to develop this skill better so that I could better market myself whenever I'm applying to grad programs and also to future jobs, that I know how to use this tool because it's so important. And so about 90% of the work that I did during my internship was in Excel. And so I was able to use a lot of advanced Excel functions. I was able to definitely hit the 3 stretch assignments, and I'm really a lot more comfortable and confident in my Excel abilities. Another one of the learning objectives that I focused on is that I really wanted to build valuable professional relationships with my coworkers, and not just my immediate coworkers that I would work with, but also my superiors and people that worked in different positions that I didn't come in contact with a lot. I really wanted to get to know everybody in the office. And so I connected with everybody on LinkedIn, and I also made sure to conduct informational interviews with a couple of my coworkers that I didn't come in contact with a lot, so I could better understand their role and build that relationship with them. Another learning objective that I had is that I really wanted to understand the role of a health and benefits consulting analyst. Coming into this internship, I had a pretty good understanding of the healthcare sector and the healthcare field, but I had very little understanding of the health and benefits side of everything. And it's so much, I honestly thought that I would be working for an insurance company. I was a little confused when I came in. But this is something totally different. It's a third party that helps employers build health and benefits programs for their employees. And it's really important. So I was able to learn a lot more, not just about this field, but also specifically what a health and benefits consulting analyst does, what their role is. And then lastly, I really wanted to get better at professionally communicating with my colleagues. This was the first time that I worked in an office setting, and I really wanted to make sure that I was using best practices while talking to people in conversations, but also in Outlook and on Teams, that I just was presenting myself really well. I was presenting my ideas and thoughts well, and that I just was following best practices for communication. So a little bit more about my internship. Mercer's mission, specifically their health and benefits program, is to empower employers to manage health and benefits costs, improve the quality and cost of care, and simplify the experience for everyone. And some of the responsibilities so that they're able to do this is that they focus on providing health and benefits consulting services to organization. This includes advising on health and wellness programs, employee benefits, healthcare cost management, and strategies to improve the overall health and productivity of employees. And then my specific internship duration, I started on June 17th, and I'm going till August 23rd. So I actually have 2 more weeks left. And then afterwards, I'll be staying on part-time while I finish school. So some of my specific responsibilities that I did as a health consulting intern is I worked specifically with the analyst team, and we have kind of 3 general roles. They have the analysts, then the account managers, and the consultants. And there's more roles built into that, but that's the generalized version of it. And I worked specifically with the analyst team, but I reported to everybody. So if anyone needed help on a project or something completed, whether they were an account manager, a consultant, or an analyst, they would come to me, and I was kind of a catch-all for the whole team. And some of those specific responsibilities that I had and things I would work on is I would analyze data and produce client deliverables. I would clean data and prepare exhibits for clients, manage client plans, provide global benefits management programs, assist with updating associate handbooks on benefits, and so much more. And I can go into more of the nitty-gritty details of what I did, but this is the overall generalization of some of the different projects that I worked on as an intern. One of the public health theories that really stuck out to me that I applied and saw applied um, at Mercer in the health and benefits sector is the ecological model. And whenever consultants are working with employers in their HR group, they worked with CEOs and all these things, these people um, that are in charge of companies and a lot of employees, is they would work with them on how to develop these health and benefits packages. And what really influenced what the health and benefits package looked like was interpersonal factors. Whoever's in charge of these things, what knowledge do they have, what attitudes do they have towards different benefits and things like that, really impacted what they valued and what they wanted to put their money towards to help their employees. I also saw community factors was a big influencer in health and benefits programs. Depending on where you live, the people in the community value different things. And so depending on where you live, your health and benefits program can change because people's values differ on their communities. And also public policy, depending on what state you live, there are stricter or less strict guidelines for health and benefits packages and should be included, what shouldn't be included. So that can also influence this field. Some of the challenges and solutions that I faced while in my internship is that I had a lot of projects where I was confused on a few items, and I was very hesitant to ask for help because I didn't want to bother people and I wanted to be mindful of their time. But I really quickly realized that part of the learning process is asking questions and getting help. And there's some things that I just can't do myself. So some of the solutions that I made is that I learned how to professionally communicate that I needed help. And I also got a lot better on asking for specific instructions when I received a new task and also asking clarifying questions if I was confused. And for ethical and cultural considerations, I really didn't experience any ethical or cultural dilemmas in my internship. What I did experience, though, is an entire new culture, which is office culture, and how to adapt to the office culture and how to utilize these new professional best practices and how to interact with people. And so while I wasn't using the stereotypical ethical and cultural considerations, I was adapting to a new office culture. Some of the achievements and impacts that I had throughout my internship so far is that I worked on projects for over 14 different companies. I assisted the entire Salt Lake City Mercer Health and Benefits team consisting of 25 people, and I assisted my colleagues in creating quality health and benefits packages that impact thousands of employees in Utah. I was also offered a part-time position, which I was really excited about. And some of the personal and professional growth that I had is that I greatly improved my professional communication skills. I also improved my technical skills using Microsoft Office and my Excel abilities. I vastly expanded my knowledge of the health and benefits sector, and I also gained more confidence in my public health knowledge and my abilities that I learned in my undergraduate studies as I applied them in my internship. And some of the lessons that I learned while in this internship is that quality health and benefits programs improve public health. Health and benefits programs cover the type and quality of insurance programs offered to employees. They determine maternity and paternity leave, pet insurance, hospital indemnity insurance, workplace wellness programs, accident insurance, life insurance, and so much more. That's just scratching the surface of everything that's included in health and benefits packages. And so employees that have really good health and benefits programs, they're more productive, they have a higher quality of life, and it improves the general public health. And some of the future goals that I have that have been influenced because of my internship is that I'm finishing school in December, and so I'll be working part-time as a health consultant at Mercer. And then also as I apply for MHA programs and decide whether I want to go straight to school or work at Mercer full-time. At first, I just wanted to get my MHA, and now I'm kind of debating, so we'll see what I do. And just to conclude, this internship has taught me so much about the health and benefits sector, how health benefit packages improve employee quality of life and improve public health. And I will definitely consider going into this field for my future career. Thank you.